Have you dealt with in the past, or you're currently dealing with sciatica down one of your legs? In this video, if so, this video is today's for you. So what we're going to go over is a little bit of what sciatica is, what it commonly presents like, and then we're going to go over a couple different movements that we will prescribe for patients that we see that are dealing with sciatica-like symptoms. Now, like always, I would recommend you be evaluated by someone first if you're currently dealing with sciatica-like symptoms, because everyone presents differently, and you want to make sure that you are getting the right exercises specific to your case. So what is sciatica? At its basis form, it's an irritation of the sciatic nerve. And the sciatic nerve is that big nerve that comes out of our lower back, and then it goes down the back of the glute, and it goes all the way down the back of the leg. Very typically, when you have an irritation of the sciatic nerve, it can be from anything. It could be from just bending over to pick something out of the dishwasher. I commonly see it in CrossFitters that get hurt or irritated deadlifting, squatting because of loss of stability. That's one of many factors, but it could be due to anything. So typically what that looks like is pain with bending forward. So it could be either right away, or they might not feel pain until they're right at the bottom, or not until they're coming out of that forward flex position. And typically it will, as they're bending forward, it will intensify their symptoms down their leg. I mean, it usually goes, if it is true sciatica, it's likely going to go past the knee, so it could stop either in the calf or down into the foot, ankle, sometimes even the big toe a little bit. You can have either that sharp, zinging, burning pain. Some people get numbness as well. That's a general overview of what sciatica is and what it looks like. Typically for patients that are dealing with sciatica-like symptoms, they feel a lot more comfortable being in a more upright, extended position versus being in this bent forward position. Again, that's a very general overview. Not everyone presents like that. That's just more commonly what we see is more preferred for sciatica, especially due to a disc herniation. So what that looks like from a treatment standpoint is, if you feel more comfortable being in this upright or extended position here, then we call that an extension preference or an extension bias. And we're going to do a lot of extension-based activities in order to get your symptoms to calm down. One disclaimer I want to make with these exercises, if you're having sciatica pain right now, is what we do not want, especially if you're getting pain, if you're getting pain down into your calf, your foot and ankle, we do not want those symptoms to increase down in the calf, foot, ankle, or toe as we're doing these exercises. What is an appropriate and positive response is, say you're doing one of these exercises we're going to show you, if you start to feel a lot more pain in your low back, but the pain is moving away or decreasing from down low at your foot, ankle, or wherever it is, that's a good sign. A lot of people get discouraged where they're doing these exercises and they're like, oh man, my back really hurts. Why is that? And my next question always is, do you feel it as much in your foot? And if the answer is no, great. We call that centralization. That's a good response to the extension-based movements that we are going through. So that's just an important thing I like to make note for our patients before we start this stuff. So what we're going to do is start here. We're going to start in a prone press-up. So you're going to be lying on the floor here, and you're going to have your hips on the ground. For some people, all we're going to be able to tolerate is going up onto our forearms. Ideally, we want to be able to work up to getting onto our hands and keeping our low back down the entire time. So I'll typically start with people about 15 to 20 reps. So we're here, and let's just say this is 20 right here. And I'm going to see how they've responded so far to that. And then I'm going to have them hold it for maybe 30 seconds to a minute. So we want to see, do some people feel better with continuous reps, or some people feel better with isometric holds. So that's one thing that we want to do. And someone that does have a really flared up sciatica due to a disc herniation, especially if they're sitting at a desk, I'm telling them to do this, as frequent throughout the day as possible. Should be doing like 100 a day roughly. So that's the first one here. Now the next one is going to be a common exercise that's done for a cat-cow, but we're going to really focus on avoiding one of those directions. So we're going to be on our hands and knees here, and I just want you to focus on really just that low back here. So what I do not want is I don't want an aggressive rounding of that low back, because again, that's causing flexion, and that is probably going to irritate those nerves down there. So we're going to be in this position here, and I just want you to focus on extending your low back. So it's almost like you're dropping your belly button down to the ground, and then you just come back to neutral. You don't go past it right now. Eventually we would, but right now we're just working on that and coming up. Okay. Then the next one we're going to do, and the last one, is going to be standing extension. So what I'll have people do, I'll have them take their hands, make a C almost, and you're going to find these bony prominences on the back of on the lower part of your back, right off of your sacrum. And then you're going to move up a little bit. Okay. So you're going to be there. Your thumbs are going to be here. And then you're going to gently apply a little bit of pressure forward as you lean back. And don't worry about going as far as possible. Start small and then gradually increase the motion as you go forward. So again, it's going to look like this. Okay. So those are 3 movements we'll typically do during the first couple sessions for someone that's dealing with really irritated sciatica, just to get their symptoms to calm down. We would eventually start to work towards getting to flexion-based movements, but for right now, if someone has a preference to extension, that's what we're really going to focus on to get their symptoms down. So if you're dealing with sciatica or you have any questions about your rehab or what that might look like, feel free to give us a call, check out our page. You can use the link down below, and we'll be more than happy to chat with you and see if we're able to help you in any way.